This is Menopause Energized 30-day Healthy Heart Marathon, day 3. Hey everyone, welcome back. Welcome back to day 3 of the 30-day Healthy Heart Marathon. Yesterday we talked about some of the important checkups that you need to keep up with every year. My whole purpose for developing this 30-day marathon is just to make you more aware of what you need to do and modify your lifestyle during this phase of your menopause journey. So I felt like it was appropriate enough today to bring in knowing your numbers. It is so important to know your numbers. What I mean by that is your cholesterol numbers, your blood sugar numbers. What should your blood pressure be, which we talked about that a little bit the other day. The more you are aware, the more goals you can reach, the more you can take control or take back control of your life. Sometimes and I told you my program specifically around women's health in the menopausal years. And in our menopausal years, sometimes we feel like we lose control because it seems like everything is going wrong. But we can take back control and get our power back. And one of those ways is knowing what is normal as far as your numbers when you do finally reach that doctor's office. So today we are going to start with the high blood pressure. Now, the more reliable results are from the Mayo Clinic, the Cleveland Clinic, and the American Heart Association and the American Diabetic Association. Because when you're out in the surroundings, you'll hear people giving you all types of values and numbers of what everything should be. And then that just confuses you even more, and it may set you off track thinking you're doing the right thing, which may not be the case. So I'm just going to try today. It's going to be, I keep saying 5 to 10 minutes each day, but it winds up being a little longer. It's just too much information to push in 5 or 10 minutes. But I am going to try to clear up today some of the confusion around these numbers. We will not go in today about nutrition and all that stuff for high blood pressure because I already discussed that fully in full detail in my 3-week mini series nutritional program, which you can check that out on my website. So let's go back with hypertension. We went over it earlier the other day. We're going to go into it a little more in detail today. Again, high blood pressure for the American Heart Association. When you go to your doctor's appointment, just remember, your blood pressure should be a little less than 120/80. And yes, I know that is kind of hard for some of us now, not all of us, to maintain. But that is the new rule now for the American Heart Association. Again, going back to if you have had high blood pressure for 15, 20 years, 10 years, whatever, or more, and your blood pressure is used to being around 130/80, your doctor may be okay with that. That's why when you leave your doctor's office, you need to know from the doctor, what should my goal be? That don't mean for you to go out and cheat on this and cheat on that. That's high in salt. You just want to know what you should be maintaining because everybody at that age is not going to be able to maintain a blood pressure systolic or lower than 120. So believe it or not, the American Association now says, again, less than 120/80. They do divide it up to phases. This is just to give you a warning sign. Again, our body is not our enemy. It is our protector, and it gives us these solid whispers to let us know most of the time now that something is going on, and we need to pay attention to those whispers and not wait till the last minute before they decide they're going to scream out at you. Pre-hypertension, after you get past 120/80, 120/129 to this diastolic 80/90 is pre-hypertension. The reason why I'm giving these results, because if you get these results back from your doctor, there you go, take control. You know now that you really need to monitor your pre-hypertension level. Stage 1 goes up to 130/139, diastolic 80/89. If you go into the doctor's office, the doctors may tell you, oh, you're okay. But I'm telling you, when you see these numbers, you need to monitor and keep track because they can steadily go up pretty quick. I'm not saying anything is going to happen to you with those numbers. You're not going to have a stroke or heart attack, anything like that, because these numbers are saying they're dangerous. I'm just telling you, watch those numbers and make sure they don't continue to creep up. Then we have stage 2 hypertension, 140 or higher, diastolic 90 or higher. This is when you really want to be careful. This is stage 2 hypertension that you definitely want to monitor your blood pressure. I advise every woman to have a blood pressure cuff in their home. Again, like I said yesterday, you don't let it take control of you, but you should have it in your home. At least take it once a week, once every 2 weeks, whatever you think you need to. If you see your numbers climbing up, you might want to do it more frequently. I'm not telling you that every time you feel something, you run in the room and take your blood pressure. I'm not saying that at all, but I do think it's a good idea, especially for women that's at high risk for high blood pressure, and your doctor is telling you your numbers are climbing up, you should own a blood pressure cuff. Hypertensive crises. Now this is where we get into the danger zone. Hypertensive crises right here is a blood pressure systolic greater than 180. Most people will start to experience symptoms. When your blood pressure is that high, you really should seek medical attention. This is whether you have high blood pressure or not, or if you have high blood pressure on your medication. If you've just taken your medication, it's 180, that's the difference. You might want to wait a little bit to retake your blood pressure to see what it is. Maybe like a half an hour after you take your medications. But this is considered the dangerous zone. Different type of problems can happen. We already know it. I don't even have to explain it. Stroke, heart attacks, different types. Also TIAs, transient ischemic attacks you can have from this. They kind of float through the brain because there's a little bit of circulatory problem there because your blood pressure is so high, and it starts giving you symptoms. You can get symptoms like dizziness, your gait is off when you walk, you're kind of walking crooked, you may get a headache, you may even sometimes maybe get a little slurred speech, but it dissipates quickly. With a full-blown stroke, those symptoms don't go away just like that. They could stay for days, months, and some people have permanent deficits from a stroke. We call it also CVA, cerebral vascular accident. So that's enough on there. Like I said, I don't want to keep you here all night. So know your numbers. You can write this down or rewind this recording back and then, take some notes. But you should know what your numbers are when you go into the doctor's office and when you leave. We're going to go into the blood sugars. Here's another myth for blood sugars. You hear people giving you all type of numbers of what your blood sugar should be. I go by the American Diabetic Association that says for people that are not a diabetic, blood sugars should be between 80 and 99. The people with diabetes, your numbers are going to be a little different. It should be 80 to 130. And the reason for that is because your body has kind of over the years or months or whatever it's been, kind of got used to that sugar being a little high. So it doesn't tolerate when your sugar drops real low. I'll say, so for instance, for me, I'm fine at 80 or 90. For a diabetic, when their sugar drops to 80, they can feel it. So diabetics, for people with diabetes, it should be between 80 and 130, and your doctor's pretty much satisfied with that. Again, though, you always talk to your doctor, make sure that's the goal that she wants to see you at. Most of the time, again, in older patients, 60, 70, and 80, that has had high blood sugar, pretty much controlled, but the body's used to the levels being high, your doctor would say 130 is fine. In 2010, they decided to did some research and bring on a new level called A1C. Actually, the whole thing is called HB, which is for hemoglobin A1C. It has to do with hemoglobin molecules in your system, and it gives you a percentage of what your sugar has been running in your blood over a 3-month period of time. And that's what the doctors really like to go by. Because even though you may go in and get a reading of 80 and a fasting blood sugar, that don't necessarily mean that your HbA1c is going to be normal. Remember, the fasting blood sugar is only testing for that day. You get that fasting blood sugar before you eat. Of course, they're going to tell you not to eat, so that would be accurate. If you ever get a blood sugar that's high and you've had a meal, that's a false blood sugar reading. You have to wait until your stomach is kind of empty. So usually when you get up in the morning before you eat, or even after you eat, maybe 4 hours later, that's a good reading of a blood sugar. But that sugar for that day does not tell the whole story. That HbA1c tell what was going on with those sugars through the whole 3 months. That's a better predicament for the docs. So a normal HbA1c is 5.7%. Know your numbers. When the doctor gives you that number, you can still ask the questions, but this time you can go in with power. You can go and feel like you have control because you already know what those numbers are going to be. For a person that's been a diabetic for many years, again, doctors may tell you those numbers. Probably your goal will be a little higher because your body has been used to having a high blood sugar. For some, long as the doctors see it 6 and below, they're fine with that. That's not every doctor. It depends on the patient. Doctors have to treat that patient as an individual, not put them on the train line with everybody else. 5.7 to 6.4 is prediabetes. So right there, you need to start thinking about how you can modify your lifestyle and diet so you can either get these numbers down and also if you're overweight, possibly thinking about losing weight. The reason why I say that, if you let this get out of control, a lot of times that prediabetes go into diabetes. Prediabetes can be reversed. As a matter of fact, there's some research that shows diabetes can. And I really think it depends on the individual, how they maintain their lifestyle, and I think a lot of it has to do with genetics as well. This is what research shows actually. But if you don't take control of this prediabetes, it will lead you into the diabetes, which is 6.5 or higher. Again, prediabetes is reversible. They do not mean now also when you're a diabetic and you have these numbers and they're looking good that you can come off your medications. I have talked to so many people that just come off of their medications. Don't check with their doctor. They just decide they feel good, their numbers look good, and they're going to come off. And that's the worst thing to do. I have some really horrible nightmare cases of patients that did that with their medications for their diabetes and also high blood pressure medicines. And to backtrack a little bit, patients that come off their high blood pressure medicine because they feel like they don't need it. But I'm going to tell you one of the main reasons why a lot of patients, not a lot, I keep saying a lot, some come off, they said they do not like the way the blood pressure medicines make them feel. Yes, there are some side effects for some not. But the thing is, would you rather just tolerate some of those symptoms of feeling tired and dragged out, or later on having the blood pressure go way up and having some serious issues from that? Always talk to your doctors about your medications. If you feel like they're not agreeing with you, talk to your doctor about what they could switch to help you manage your blood pressure without feeling really tired. I will tell you, a lot of blood pressure medications, some of them, or I should say some, do make some people tired, but not everybody. But you may want to talk to your doctor about modifying your medications. And then for diabetes, I've also have had patients with a HbA1c 11 and 14%. That is really, really high. Now we're going to go last but not least. I don't want to keep you too long. We're going to go to the cholesterol. That is so important for heart disease. It's keeping your cholesterol under control. So we're talking about cholesterol levels here. For your cholesterol, total cholesterol level is what you have, what they measure. They measure the total cholesterol. They measure the HDL, which is the good cholesterol, LDL, which is the bad cholesterol, and triglycerides are not good either. And I'll explain that to you in a second. Your total cholesterol should be less than 200. Don't worry about what numbers go between there. I mean, the little mg or whatever. You just want to know 200. Your cholesterol is a total of your HDL and LDL. And so basically your HDL is your good, your LDL is your bad. If your HDL is really good and your LDL is low and they take it in proportion, you'll probably have a better total number of cholesterol. That's how it works. It's not including the triglycerides. It's just including the HDL and the LDL. So that should be less than 200. Your HDL is your good cholesterol. What it does is it sweeps away the plaque out of your arteries. So it sweeps away the plaque out of your arteries. The next one is your LDL, the bad cholesterol. It deposits plaque on your arteries. So you don't want that at all. Your LDL should be less than 100. Your HDL should be greater than 60 or more. And some people with risk of cardiac disease, your doctor is really going to want to see these LDL number lower. Triglycerides should be less than 150. Let me tell you what your triglycerides are. When you eat a lot of sugar, carbohydrates, and what else? Starches, any of those really high all the time, your body can't distribute it where it needs to go. So guess what happens? It takes that excess amount and deposits it into your adipose tissues, which is the fat tissues. That's part of your weight gain right there. So think about it. It makes sense. People that you see eating all the time, the sugary foods and high starches and carbs, and they have, a lot of weight on them. Triglycerides is because it's being deposited into the fat tissues. The most danger in these numbers, number one, would be the LDL. Big risk for heart disease leading to possibly heart attack, stroke, because the LDL is the one that deposits the plaque. When that plaque breaks off, it travels to different parts of the body. It could also possibly travel to a vital organ like the heart, cut off circulation, and that's when you'll have problems. Let's see, we said the LDL. The triglycerides is the next dangerous one. When those levels stay high in the blood, in the arteries, it also messes up, it constricts, and it also can cause a lot of inflammation and damage to the arteries because, like I said, they'll do the excess in the adipose tissue, but then the rest of it is still kind of hanging around in the blood, and that is harmful to your arteries. And then the cholesterol, of course, is the next one, and again, you want to keep that below 200. The last thing we're going to talk about is vitamin D. Vitamin D, research has shown that when you have a low amount of vitamin D, puts you at risk for high blood pressure and certain heart conditions. So vitamin D, we make some in our body, but it comes from the sun. When it hits your skin and gets absorbed, it makes vitamin D3. For darker complected women and African American women, we have a lower vitamin D level because of the melanin in our skin. The sun cannot absorb as much than a person of a lighter skin complexion. So we find that we have a lower vitamin D level. Some of us walk around for years with a low vitamin D level and never know it. And if you don't go to the doctor every year to get your physical, because the doctors they didn't used to do this a lot back in the day, but now they will get a vitamin D level at a certain age because more and more studies are showing that there are a lot of risk factors that happen from vitamin D. I've been on vitamin D for over 18 years. The first time I was feeling, I guess, mainly tired and weak, and my vitamin D level was less than 20. Your vitamin D level should be 20 to 50. That's what you want to maintain. So you want to make sure when you go get your blood work, you make sure that doctor is doing, especially women in their menopause year, is doing your vitamin D level. Because women has walked around with a low vitamin D level for years, having different symptoms, not knowing why, and come to find out they have a low vitamin D level. And so those are the blood work and numbers you should be writing down, and you should know when you go to your doctor's office or when you leave. Because when you know these numbers, knowledge is everything. It helps you to understand what's going on in your body and what you need to do to help maintain these healthy levels to help lower your risk for cardiovascular disease. So that is it for today. I hope you found some of this information useful. Comment, like, share, and subscribe, because this is day 2 and we'll be going up until day 30. Each day bring you some tips. Tomorrow, which is appropriate to me, is to flow right into some of these conditions, go into it a little more. And tomorrow we're going to go into discussing hypertension a little more depth. Today, I always say each time I do this video each day, you should be able to take away something today, starting today, to start getting your heart healthy. And it'll be the same like that every day. So today is knowing your numbers. You can start today. You already know what your blood work should be. For any of you all that's going to your doctor soon, you know your numbers and what you need to maintain and what your goal should be. Until tomorrow, take care.